Hello, everyone. Welcome to today's Facebook Live discussion. My name is Jillian Parker, and who you see alongside me there is Jaime Burleson. She is a lactation consultant in the Twig Birthing Center at Rochester General Hospital. Jaime, thank you for joining us today.
Thank you for having me.
And, we're here to talk about breastfeeding, given that this week is internationally recognized as World Breastfeeding Week. Before we get into any questions, I just want to remind anyone who might be tuning in to feel free to leave your questions in the comment section. I will circle back around at the end to see if you have any questions, and we will have Jaime answer them. But Jaime, I'll just kick it off with you and ask if you can just simply talk about some of the work that you do as a lactation consultant.
So in the hospital setting, anybody that's breastfeeding, once they have their baby, we do a whole consult with them. We do a medical history, a medication review, a education visit. We help them with their feeds. We are just really their cheerleaders and their educators so that by the time they go home, they feel confident in being able to fully breastfeed their babies.
What are some of the biggest benefits to breastfeeding your child?
So there's benefits to mom and baby, and oftentimes people don't realize the benefits to mom. But for baby, mom grew this baby, so now she's making food for this baby. So it's filled with immune-boosting, disease-fighting properties. So babies that breastfeed generally are healthier. They have less vomiting, less diarrhea, less asthma, lower rates of diabetes, obesity, childhood cancers, skin conditions, a variety of different things. And every time baby feeds, they get extra added benefits because mom's body is sort of understanding all the different things that baby's exposed to and adjusting that milk accordingly. And then benefits for mom, people often forget that that's important. And sometimes that really helps moms to know that it's not just helping baby, it's helping them. So for moms, first of all, it's free. There's no mixing, there's no measuring, there's no washing, there's no running out. So the convenience factor is huge. Moms have decreased risks of all kinds of GYN cancers, obesity, diabetes, a variety of different medical conditions, which is kind of interesting because many people don't realize that. So we make sure that the families understand those benefits as well, because those are huge.
For any new moms or moms that are, or potential moms expecting new babies, any tips as far as how long I should nurse my baby during each feeding, how a new mom would know if their baby has had enough?
Yep, those are very common. So, I say to people, you and I don't eat at the same time every day, so we can't expect babies to do that. So guidance says we should feed them as often as they want to eat. So whenever they start showing signs they want to eat, those are good cues they want to feed. We aim for at least 8 to 12 times every day. And then when the baby's on the breast, we really watch the quality of the feed, because just because a baby's there for a certain amount of time doesn't necessarily mean they get the whole feed. So we teach families how to watch for that nutritive sucking, how to listen for swallows, and really be able to watch that feed to tell babies getting milk transfer. And then we give them a really handy log the first couple of days where they write down all their feeds, their pees, their poops, so that they can see what we expect baby to be doing and where they are in meeting those goals. Just because there is a lot of misconceptions, and I don't know how no baby's doing, so we teach them to count their pees and poops and all of those sorts of things.
Now, you mentioned the benefits to both mom and baby when it comes to breastfeeding. And I know something I've heard, I'm not a mom yet, but something I hear a lot is that it also helps form a bond between the two. Can you go into detail on that?
Well, breast milk production is based on hormones. And those hormones, the main one is called oxytocin, and that's sort of the mothering or the love hormone. So every time baby feeds, it releases this hormone to make more milk. And that also helps to relax mom, decreases her stress, decreases her anxiety, and helps that bonding role. So, breastfeeding is just as beneficial for baby as for mom. And actually, moms that breastfeed have a lower risk of postpartum depression because of that.
Now, sometimes moms struggle when they try to start breastfeeding. Is there anything they should be doing, or will it just get a little bit easier as they continue to try? How does that work?
I try to remind moms that the pregnancy is about 40 weeks. So by the end of those 40 weeks, you're good at being pregnant. You might not have loved every minute, but you got really good at being pregnant. So it's going to be the same with lactation. It's not going to happen immediately. Baby comes out and doesn't know what to do. Mom doesn't know what to do. So it really is a time thing. And that's what we try to remind patients, because a lot of people come in thinking the baby immediately is going to latch on and mom's going to have all of this milk. It's a time thing. So here at our hospital, we make sure that the nurses are able to help. We assist with feeds. We just give all of that reassurance, because it doesn't happen immediately, but it takes a few days for them to feel confident in it. And that's all that it is. The more often they do it, the better they get at it.
And how will you know when your milk is ready and it's kind of come in?
Yep. So the first couple days is that colostrum, which is the early milk. Usually for vaginal delivery, it takes about 3 to 4 days for your milk to come in. For a C-section, about a day longer. So moms will go home here. We make sure they're seen by their pediatrician the next day for that continuation of care, so that they can help make sure that that milk comes in as well, by weights and pees and poops and feeds and that sort of thing.
I just want to send another reminder that we're with Jaime Burleson, lactation consultant. If anyone has any questions for her, we're talking about World Breastfeeding Week. Please leave them in the comment section and we will get to them when we're done with our Q&A here. Jaime, my next question for you is misconceptions. Are there any misconceptions about breastfeeding that you'd kind of like to clear up?
Yeah, there's a lot of them. You know, the first one is that, like we already touched on, people think that baby's going to come out and immediately feed really, really well. And that's not necessarily the case. They have just gone through this labor. They're not really sure what they're supposed to do. So it often takes them a little bit of time to sort of learn how to do it. Another thing is your milk isn't going to be in right away. The more often a baby feeds, that tells your body to make that milk and to bring that milk to baby. So those frequent feeds is what gets that milk in. Babies are going to be up more evening and nighttime, and a lot of people don't expect that. So they automatically think a baby feeding frequently is a bad thing. In fact, it's a good thing that they feed. The more often they feed, the more milk you make. But that will be mostly evening and nighttime, kind of like when the mamas were pregnant. And then breastfeeding can feel very one-sided for mama because she's the one physically doing it. But we make sure to teach the support people that while they can't physically breastfeed, they can do all of the other things. So they can change the baby's diaper, they can get the baby burped, they can wake them up. And then when mom's done breastfeeding, she can hand the baby off to the support person who can settle the baby. So while mom's the only one physically breastfeeding, be able to help people help you is a nice thing. It really takes some of the burden off of mama.
Now, 2020's message from the World Health Organization, they said supporting breastfeeding for a healthier planet. Can you talk about steps being taken at Rochester Regional Health to educate moms about the benefits of breastfeeding?
So it starts in the prenatal setting. Once a mom starts her prenatal visits at whatever OB group she goes to, they start that prenatal education. Nurses, doctors, they all touch on stuff throughout the pregnancy at their visits. They give them information on how to sign up for classes. Our classes sort of have been a little bit different lately because of COVID, so we've not been able to do in-person classes. They're all online, and starting next week, we're actually going to start doing our prenatal breastfeeding class online. So patients can call the link line and sign up for that, so that they'll be getting a Zoom code, and I'll actually be teaching the class, so that certainly helps. And then once in the hospital, because we're a baby-friendly hospital, all of our nurses are specially trained in lactation. So every single feed, a nurse is available to help with feeds. Lactation will come in. We'll help with all the education. We'll make sure that they have a breast pump for home. We make sure to set up their pediatrician appointment. And then there's lots of discharge lactation support on the outside as well for these patients. So we try to make sure from the start of the pregnancy till the end of their lactation, they have support. My office number we give them, somebody's in the office 7 days a week. There's baby cafes that are free places that they can drop in to get lactation support. There's 3 of those locally every week as well. So we try to make sure we have lots of resources for these families for before, during, and after the whole process.
I can hear you, but I'm frozen on my end. Are you frozen on your end? I'm just curious.
No.
You're not? Okay, so I will keep going then. Maybe it's just my computer. What are some of the different options for breastfeeding education and support through Rochester Regional?
So again, right now things are a little different simply because of all of the COVID. Right now you can go online and buy online packages for prenatal classes. We don't have any in person right now because of the visitor restrictions. But starting next week, we are going to do a monthly breastfeeding class that it's going to be via Zoom. So patients can call 922-LINK and get signed up for that, they will be issued a Zoom link, and then I will be doing those classes. It'll be a 1-2 hour class that will be held once a month for right now until we can get back into the in-person classes.
Okay. And kind of, I want to close things out here. My computer's having issues. So if anyone is leaving questions, I am sorry. I'm not going to be able to take a look at them, but we will look at them after we're done being live and we can answer them through the text section. Some people might be concerned about breastfeeding if they have pre-existing medical conditions or if they're taking any prescription medication. Is there anything you want to clear up there about whether or not, people are safe to breastfeed if they are taking anything?
Yep. So there's almost no exclusions for mom as far as medical history. Medication-wise, there's some medications that are better than others. We look at those all individually. We have all sorts of research-based education that we can look at to look at medications. Most medications are safe to be breastfeeding with. It's a different delivery system than when mom is pregnant. So most medications are completely safe, but yes, that's part of what our assessment is. Every time I go to see a new mom, I look at what her current medications are, review them with her, and then go from there.
Now, Rochester General Hospital is a baby-friendly hospital. Can you go into detail with everyone about what exactly that means?
Baby-friendly is a designation awarded by the World Health Organization and UNICEF for birthing facilities that go above and beyond to help the breastfeeding family. Out of, I believe 5,500 birthing centers in the U.S., less than 1,000 are baby-friendly. So it's a hard to obtain designation, and it just requires everybody that comes into contact with these families has additional support. So all of the nurses have extra training. They come to the classes. We have all the most up-to-date information about breastfeeding to support these families with that, whatever their goal is for feeding their babies. And we really find that helps, so that every nurse, every doctor has the same information for that continuity of care.
Given the amount of, health systems or hospitals, I should say, that are baby friendly, what does it mean to be able to work for one that is?
We were the first one in New York State. We've had it for 20 years now. So we were the first one in our health system. We were just redesignated again in February. So it's kind of cool that it's been around for 20 years, that our hospital is one of the first. To be the first one in all of New York State is amazing, because it just goes to show our commitment and our education and our goals to help these families. So I'm very proud of that.
And, you mentioned being proud of that. Your work in general, I'm sure, is very, very rewarding a lot of the time. Can you talk about, what makes your work rewarding?
These families come in, and like I said before, they've gotten really good at being pregnant. But the breastfeeding thing really causes them a lot of nerves. And I have moms often that say, I wasn't worried as much during my pregnancy. It was the lactation that really worried me. And it frustrates me because I don't know what we've done to women in this country where they think they're not going to be able to do this. So I really say I'm usually just a cheerleader. I feel like these moms can do it. They just need somebody to really be able to say, look, you can hear that swallow. Look, that baby's stool. That means the baby's getting something. Just want that reassurance. So we're just going to be cheerleaders and just give them the education, but more than anything, empower them to believe that they can do this. I mean, they grew a human being, right? So I have complete confidence that they can do it. It's just more cheering them on. And when they go home and they say, I feel confident, I feel like I can do this now, that's really rewarding to know that they now have that feeling for going home.
That's great. Is there anything else that you wanted to say about World Breastfeeding Week, or just your job in general, being a lactation consultant, the benefits of breastfeeding that we didn't touch on?
I could talk for hours and hours and hours about it, but there's a learning curve. Moms can do it. We will help you with that. This isn't something new that we designed, right? Every mammal in the world breastfeeds. Every baby, is capable of breastfeeding. So just I try, and whatever the moms need, I go into a room and I say, what can I help you with? If she says, help me with education, help me with positioning, tell me why. And really tailoring it to her too is helpful, because everybody's a little bit different. I'm just very lucky. I have a very fun job and I love my job, and I just will try and help those moms, whatever I can help them with.
That's what they always say. You want to find something that you love to do. And, what you're doing for families is important. And we're proud to have your services within the Rochester Regional Health families. Jaime, thank you so much for joining us to talk a little bit about these benefits of breastfeeding and what it is that you do.
All right. Thanks, Jillian. I appreciate it.
And any other questions, like I said, I'm having some computer issues, so I can't read them right now, but we will take a look afterwards. If there's anything we can answer for you guys, we'll do that in the comment section. Take care, everyone.
Perfect. Thank you.